Hi everyone, welcome back to my channel. This is Angela Chung and I am a GI specialist physician assistant. Today we are going to talk about a topic that affects many people but isn't often discussed: gastric cancer. I see many patients who are suffering from this condition and I believe it's important to raise awareness about it. So let's get started. Gastric or stomach cancer is a malignant tumor that develops in the stomach lining. It is the fifth most common cancer in the world and it's often diagnosed late, making it more difficult to treat. In 2020, there were an estimated 1 million new cases of gastric cancer, accounting for 5.6% of all new cancer cases. The highest incidence rates of gastric cancer are found in Eastern Asia, particularly in China, Korea, and Japan. One of the most common causes of gastric cancer is infection with bacteria Helicobacter pylori, or we call H. pylori infection. It is estimated to be an approximately half of the world population have it. It can lead to chronic inflammation of the stomach lining, which increases the risk of developing gastric cancer. Another cause of gastric cancer is a diet high in salt, processed meat, and pickled food. These foods can irritate the stomach lining and lead to chronic inflammation, increasing the risk of developing cancer. Obesity has also been linked to an increased risk of developing gastric cancer. Studies have shown that people who are overweight or obese are at a higher risk of developing this type of cancer, likely due to chronic inflammation and changes in hormone levels. Other risk factors can increase the risk of developing gastric cancer, including smoking, heavy alcohol consumption, and exposed to certain chemical and radiation. The symptom of gastric cancer can differ depending on the location and stage of the cancer. Some common symptoms include abdominal pain, bloating, nausea, vomiting, and weight loss. Other symptoms may include difficulty swallowing, black stool, and fatigue. Upper endoscopy is a diagnostic procedure that can obtain a biopsy to confirm which type of gastric cancer. A CAT scan of the abdomen or a PET scan are beneficial for staging if a patient is diagnosed with gastric cancer. The treatment of gastric cancer may involve surgery, chemotherapy, radiation therapy, or a combination of these treatments. Treatment choices depends on the cancer stage, the tumor location, and the patient's overall health. Surgery is usually the preferred treatment for early-stage gastric cancer, while chemotherapy and radiation therapy are often used to treat advanced or metastatic disease. Prevention is an important strategy for reducing the risk of gastric cancer. This can be achieved by maintaining a healthy lifestyle, such as avoiding tobacco use, limiting alcohol consumption, eating a diet rich in fruit and vegetable, and maintaining a healthy weight. Patients with a family history of gastric cancer or other risk factors may also be advised to undergo regular upper endoscopy for screening. It is important to know that while these risk factors can increase the chance of developing gastric cancer, not everyone who has this risk factor will develop the disease. It is also possible to develop gastric cancer without any of these risk factors. Thank you for watching my video today to learn more about gastric cancer. I hope this video has been informative and has given you a better understanding of this condition. Remember, early detection is key to successful treatment. So don't ignore any symptom you may be experiencing. Please subscribe my channel and give me a like. I will see you in the next video. Bye bye.